Hi guys, Nurse Deerbear here again. So today we're going to be
An
demonstrating
IV push and DCing the IV.
So the first thing we're always going to do that we're always super very careful on is our 6 rights. Right patient, right drug, right dose, right route, right time, and right documentation. Okay, first thing we're going to do now is we're going to go wash our hands because hand hygiene is one of the most important things that we can do as nurses.
Come in.
Hi Jeannie, it's Nurse Deerbear. How are you?
I'm good.
Yeah. So, can you tell me your name and birthday real quick?
My name's Janie Sukit. My birthday is 12/23/55.
Perfect. How's your pain?
Oh, it's kind of hurting. About
Yeah.
8 out of a 10, probably.
Okay. Well, let me go check the orders and see what Dr. Cott ordered for you for pain today, okay?
Okay.
And then let's get you something going to hopefully help with that pain.
Yeah, okay, I'd like that.
Okay. So on the Dilaudid bottle, it states Dilaudid is 2 milligrams per milliliter, and I'm going to dilute it with 2 milliliters of normal saline. And I'm going to give this the Dilaudid 1 milligram every 2 minutes per IV push. Okay? So I'm going to wash my hands, put on some gloves. And I got 2 medication vials. One is normal saline, one is our Dilaudid. Okay, so I'm going to clean the tops of both of them using a separate alcohol wipe on each one. Open up my syringe. Okay, now just like always, I want to pull my plunger back and forth a couple of times to get any extra air out of there. And I'm going to inject 1 milliliter of air into the Dilaudid bottle and 2 milliliters of air into the normal saline bottle. So I'm going to pull 1. And another 45. Inject and go straight up. Now insert that one. Okay. So now I'm going to pull back 2 milliliters on this one. And I'm going to inject that 2 milliliters of air. Now I can flip it over and I'm going to pull back to get my 2 mils of normal saline. And again, I always want to make sure I don't have any air bubbles in here. And holding onto the plunger so I can pull that out. Now I'm going to use the scoop technique to cap this needle. Now I can remove this needle. Now we go into a sharp spin. Now with my second needle, I can attach this onto here. Now I uncap it. Now, since I've already placed the 1 milliliter of air into my Dilaudid bottle, I can insert And now I want to pull back 1 milliliter exactly, because if I pull back too much, then I'm gonna totally mess up my combination and have to start all over again. So now I have 3 milliliters. And again, I'm going to use the scoop technique because I do not have a sharps container. And click this one on. Now I can take this needle off. And now I have my dilaudid with the 2 milliliters of normal saline as well. So now I'm ready to give the medication to the patient. Okay, so now I have my dilaudid, and I'm going, per the doctor's orders and what is on the dilaudid bottle, I'm gonna give this over 4 minutes. So this is 3 milliliters, so I'm going to give 1.5 milliliters over 2 minutes. Okay, so I have my patient. I'm gonna clean the site. And I gotta unclamp. Okay, so now I've flushed it with 5 milliliters. Another alcohol wipe. Clean it. And now I'm ready to administer my dilaudid. Again, I'm going to clean with the alcohol wipe. Okay, so now I'm going to give this medication over 4 minutes. So I'm going to have my watch out. And I'm going to watch my watch as I start to inject it.
Slow down, or you're gonna.
Okay, so now over the course of 4 minutes, I gave the 3 milliliters of the dilaudid mixed with the 2 milliliters of normal saline. So now I can disconnect this, close my clamp. Okay, Jeannie, so I've got that dilaudid in. I'm gonna come back and check on you in about 30 to 45 minutes so we can see if that's helped with that pain at all, okay?
Okay.
Anything else I can do for you right now?
No, I think I'm good right now. Thanks, Jer.
Yep, you got your call light, and I'll be back, okay? You holler if you need me for anything though, okay?
Okay, thank you so much.
Now when I come back to assess her pain, I'm also going to assess the IV catheter site for redness, swelling, pain, or tenderness.
Hey Jeannie, it's Nurse Jer Bear again. How you feeling?
I'm feeling so much better.
What would you rate your pain now?
Oh, I bet it's about a 3.
Good, okay. Well
I feel
then
better.
it must be helping then.
Yeah.
Okay. Well, I'll be back if you need me. Okay?
Okay.
You holler at me, okay?
Okay.
Okay. Hey Jeannie, Nurse Jer Bear. I bet you're ready to go home, aren't you?
I am ready.
Okay, well, so the last thing I'm gonna do is I'm just gonna discontinue that IV, okay?
That'd be great.
Okay. And tell me your name and birthday real quick.
Janie Sukit, 12/23/55.
Perfect. I bet you're ready to go home. Who's at home waiting for you?
My husband,
Yeah? Is he making dinner?
he's making dinner. It's Dr. Cott.
Oh, you're Dr. Cott's wife? I didn't know
didn't know
that.
that?
I did not know that. Okay. I'm gonna loosen this tape along here. What's he making for dinner?
I think we're gonna have steak.
Ooh, gosh, how many steaks you got? Can I come over?
I don't know why not.
Do I need to pick up anything?
Maybe a bottle of wine or something.
I can do that. So I'm gonna remove all the tape around here before I actually take the IV out. Now that I have all the tape removed, with some gauze, place that over the site and pull it out. I'm going to put firm pressure down after that. And then I also want to check my IV to make sure that the end is still intact, because if there is a piece that possibly broke off in there, we're going to have to, there's going to be a whole lot of other problems we're going to have, and then we're going to have to send her down to get an x-ray and find out where that piece might be, because that could present a problem to us if it's not intact. But this one looks good and intact right now. Okay, so we're going to dispose of that. And we're going to hold pressure on this for about 2 minutes. Janie, can you put your finger over that
Sure.
for me? Okay. Let me get some tape. Before I put tape down, I do want to just assess the site and see if it's super red and inflamed, but there's still a bit of bleeding, so I do want to put some pressure down on that. And now, there. All right, Jeannie, well, looks like you're all good to go, so you have any more questions for me before I get you out of here?
I don't think I do.
Okay, well,
You did
I will see you and Dr. Cott at dinner tonight. You want to just follow me and I'll take you outside?
Sure, thank you.
Can we pretend that airplanes in the